Hello, friends. Welcome to the Premier Endodontics and Conservative Dentistry Institute. Today, we are going to start a very interesting and often you can say ignored topic, that is cast metal restorations. Nevertheless, very important for our MCQs. As you can see, as recently as AIMS May 2019 and 2020, questions have been coming from cast metal restorations here and there, and you all know one or two questions here and there can make all the difference in your ranks, especially important if you want to be right there in the top 10, top 20 in the country. All right. Now, as always, we'll start with an important MCQ, which is slightly, you can say confusing. Many students came back to me and gave me the feedback that, sir, we read everything. Despite that, we got slightly confused conceptually, slightly here and there, and we marked the answer wrong, and so on and so forth. So as always, we'll start with this MCQ, and in a retrospective, retrograde manner, we'll try to develop concepts. Okay. And again, multiple videos will be there for this topic as well. We will try to make this as conceptual at the same time as informative and as useful as possible to you guys. All right. So, friends, the question that came was, that is in AIMS May 2019, reduction of cusp and cusp capping helps in. All right. Okay. Now, this is actually, a question which is, you can say, more of driven from simply principles of cavity prep, but you can also say cast metal restoration, especially from the perspective of onlays, isn't it? Because the moment you do a cusp cap, you're trying to give either a partial onlay or a full onlay. Okay. You can do a direct amalgam restoration also, a composite restoration also, from the perspective of doing a reducing the cusp and capping it, obviously, no doubt about it. But just to make this topic holistic and just include even the indirect restorations, we will lay stress apart from simply the principles of cavity preparation, that is resistance form, retention form. We'll also see it through the perspective of cast restorations. All right. So let us see the important points here. We are dealing with basically reducing the cusps, okay, which obviously leads us to cusp capping. Now, what happened was that one is very obvious, that it will increase the resistance form. That's why we are doing it in the first place. The moment we go, you can see here in this beautiful diagram given in your student, this is your tooth structure, all right? This is your normal occlusal view of the tooth, right? Now, if I am to simply compress this and project it in 2 dimensions, okay, then you can see here this central line represents this central groove, okay, and these black circles, these small black dots or circles represent the cusp tips, okay. So if our cavity prep has from the central groove towards the cusp tip gone to, say, about half to slightly more than half, but less than 2/3 the distance, okay, then we consider cusp capping. Okay, whether we should do it or not, okay, fine. If you are doing, say, a direct composite, then we are primarily, we're bonding, we are using bonding procedures. So let us not do it. Probably we can do it when we are doing, say, cast metal restoration or amalgam. Okay, fine. In amalgam also, if we are doing a non-bonded amalgam, yes, we should. So that is where, you can take your call as a clinician. But what about a situation in which from this central groove to the cusp tip, you have traversed a distance of more than 2/3, then cusp capping is mandatory. All right, fine. This concept is clear. In which situation we are supposed to cap the cusp. Now, if we are to cap all the cusps, then we are in a situation where we do an onlay. If we are capping at least one cusp but not all, then we are going for a partial onlay. This is the terminology that we have to stick to, because there's a lot of confusion here. What the definition of inlay, partial onlay, and onlay. We have to follow Studevant. This is what is written in Studevant. Okay, fine. Now let us go back to the answer. Now, where the confusion was, that people said, students said that, sir, we are reducing the cusp, we are covering it, so there is another surface altogether which is being luted. right? There is a eluting cement at the interface of our indirect restoration and the tooth. So we are actually increasing the surface area. So apart from the resistance form, see, resistance form is there. There is no doubt about it. Apart from the resistance form, we are also increasing the retention form. And that is why some people said that we marked it wrong. Even good students increase in resistance as well as retention form. But this is wrong. The answer, correct answer is unequivocally, undoubtedly, only increase in resistance form. That's one. So there is no doubt about this. This is the answer. Now, the reason is that, see, the moment you decrease the height of the opposing walls, the retention form is compromised, no doubt about it. Even if you're capping it, even if you're adding another layer, another surface of, you can say a luting cement, and you're saying that you're generating frictional forces. No, not in a horizontal plane. The walls have to be absolutely opposing to increase the retention form. So there is only increase in resistance form in this situation. That's the next point. So you can see here, this is the buccolingual view. This is the buccolingual view. So you can see here, this is the occlusal step, right? The occlusal step, and this is the direction. This is the cusp tip. So again, you can see here that if you go more than half the distance, you consider cusp capping. If you go more than 2/3, you have to do it. So you reduce all these cusps by, say, for example, a cast metal only. You reduce all these cusps by 1.5, 1.5 mm, as also the inclines, the triangular ridge and the slopes. You reduce it anatomically by 1.5 mm. So, your opposing walls, which were parallel, have been reduced in height. So your resistance form, retention form goes out of the window. And your resistance form only is increasing because now you've splinted the opposing cusps together so that the wedging forces are minimal and they don't crack and fracture under masticatory loads, as also other, eccentric lateral clenching of the teeth, opposing dentition. All right. Now, the next important point is, then what are the features, especially in an onlay, especially in a situation where we have done the cusp capping, what are the features which would increase the retention as well as the resistance form? Now, that topic is very important. That is for the next video. So keep watching these videos. Secondly, gentle reminder, friends, for all of you, for our October 2022-23 batch for Cons EndoDM is starting in October. Registrations are open. Classes will be held in the online mode, live classes every Sunday, only for a duration of 1.5 hours in the morning from 9:30 to 11 a.m. You can contact me on these numbers and in my, send an email on my email address as given on the screen. You can see, and the details will be shared. Fine. So happy studying, keep working hard. Thanks and best wishes.